not only the Lung Association, but the medical profession in general has been working on anti-smoking measures for at least a half a century.
I could give testament to the harmful effects of tobacco. My patients are dying.
Both of my parents were smokers, and both of them died of smoking-related diseases.
Tobacco-related lung disease, I'm sorry, there's no way to say it. It's really ugly.
Much of my career has been trying to repair the damage that cigarette smoking has done to people's health.
It's so hard to stop. It is so powerfully addictive.
Tobacco kills, and those of us who have seen tobacco kill are major driving forces behind this bill.
This most recent bill was huge. The impact. People in restaurants and bars can really get a very substantial dose of tobacco, the particulates, the harmful substances to their lungs, just simply by being in a bar.
It's been a number of years we've been championing this cause and are really pleased that it finally came to passage.
Well, it's a glorious day for public health. We have made tremendous progress in North Carolina with this legislation, which eliminates smoking in bars and restaurants. It took about 18 years in the making. We began with legislation in '91. It makes me feel tremendous.
I think this legislation really looks forward, and the people of North Carolina have been clamoring for this for many, many years, and to see it finally happen really restores a lot of faith in the process.
Right away, I realized that how committed the ALA of North Carolina was. We finally have come to it, and you know, when I looked at legislators lighting up on the floor of the House and Senate in the late 80s, early 90s, it is absolutely amazing where we are today.
This bill is clearly a major victory for the medical profession, for the Lung Association, but more importantly for the health of North Carolinians.
The ALA did a great job of trying to fight those battles and increase awareness, and ultimately I think sort of the crowning jewel is this legislation.
Our hope is that people will see what a difference this makes in their lives, in their health, and that it will be a foundation as we build towards totally smoke-free public places. We always hear the argument of rights, but I have to ask, what can you do without breathing or smoking? And breathing is the right, not smoking.
What a privilege to be in here with all of you all, to be signing in this historic piece of legislation. House Bill 2 is really an historic moment for North Carolina. It's a huge marker in our state that we're serious about having a healthy North Carolina.
5 years ago, I introduced this bill. I think this bill is a huge step forward for public health in North Carolina. I'm proud of everybody here, and I'm proud that we're signing this bill into law today.
We don't know specifically whose life we're going to save, but we do know that there are many North Carolinians who will live longer and healthier lives because of the effects of the legislation that you're going to sign into law today, Governor. This is a historic day for public health in North Carolina.